Senator Bernie Sanders said he is set to pursue contempt charges against Steward CEO. Associated Press. Vermont, U.S. Bernie Sanders said Wednesday he is prepared to pursue contempt charges against Steward Healthcare CEO Ralph de la Torre if he fails to show up at a hearing Thursday despite being issued a subpoena. Sanders said de la Torre needs to answer to the American people about how he was able to reap hundreds of millions of dollars while Steward Healthcare, which operated about 30 hospitals nationwide, had to file for bankruptcy in May. This is something that is not going to go away. Below are your comments. What occurred is a very clever way to leverage federal medical payments into a real estate play which allowed the Cerberus and Steward management to pay themselves lots of dividends from borrowed equity. These loans were made because of the cash flow from federal medical payments. The problem is they pulled too much capital from the hospital company, which caused shortfalls due to high rental payments to the Real Estate Holding Corporation, which basically purchased the real estate assets. This type of fleecing of the equity is not uncommon in many businesses, and the entity which provides the equity liquidity ends up going upside down. Healthcare companies are like insurance companies, they are quick to pursue their clients for money, but they run and hide when they have to deliver on their contracts. He can plead the fifth, but he still needs to show up. Good for Sanders for not deferring to a wealthy CEO and his powerful lawyers and media flacks. Along those same lines, how are most members of Congress millionaires while the U.S. is $36 trillion in debt? Nothing like being price gouged by the healthcare cartel and a corrupt Congress from cradle to grave. In plain sight. In 2021, the healthcare cartel, to maintain the status quo, spent almost $700 million. Lobbying 535 members of Congress with about 3,100 lobbyists and about half are former government employees. How many of you have LTC, long-term healthcare insurance? 7.2 million. How many Americans do you think wind up in an institution or destitute and surviving with Medicaid? 48. Think about it. 28 million with limited to no access to a doctor or hospital, 70 million underinsured, over 500,000 with a medical bankruptcy, and 20% of all Americans with a medical bill they cannot pay. Across the U.S., 180 rural hospitals have closed since 2005. Of the states that have seen at least one rural hospital close over the past decade, Texas leads with 21 rural hospital closures, second TN, at 16 closures. If you live in a large urban area, there is no better. Half the country lives below the poverty line, and that limits access. If you are a part of the top 5%, you will have no fears of dying destitute in a nursing home. 95% of you are not, and many of you still think single-payer, buyer healthcare aka Medicare for all is socialist construct to steal your freedom? It covers everybody, has in-home nursing care, and actually saves money for everyone. Please subscribe to my channel. And if you like it, please thumbs up.